you a woman over 40 and have problems with sleeping, feel crazy and moody, get hot flashes, night sweats, and just don't feel like yourself? Well, you are not alone. A third of all women your age suffer from menopause. Symptoms can start from as early as in your 30s and continue up to your 60s and beyond. Hot flashes are the most frequent symptoms of menopause. Hot flashes happen in more than 2/3 of women during menopause. There are many symptoms of menopause, including irregular periods, weight gain, and slowed metabolism. Women undergoing menopause can also experience feelings of sadness, lack of motivation, and aggressiveness. Women can try and maintain the symptoms of menopause by eating healthy and doing some exercises.
I become terribly forgetful and irritable. I'm on fire. I can't sleep. I toss and turn all night. I jack awake drenched in sweat. I wake up happy, but by lunchtime I'm miserable and just cry for no reason. Now, these are true quotes from South African women going through menopause. Now, how can these women be relieved of these symptoms? Our special guest, Dr. Trudy Smith, a gynecological oncologist and obstetrician, practicing in Parktown in Johannesburg, will help us answer these questions and more. And by the way, to pose any question on female menopause or just simply share your experience, please call us on Johannesburg 714-6843, 6847, or 6857. Dr. Smith, welcome to the show.
Thank you for having me.
Right. We've seen quotations, we've seen women go, this. What is this menopause?
Well, the word menopause actually means the last menstrual period. Right. So it's the last ever period that you have.
Right.
So we say we're in menopause, but in fact we're post-menopausal.
Okay.
So we're after our last menstrual period.
Okay.
But it can take 2 to 9 years before we have the symptoms, and that's when it happens.
So the actual term means end of menstruation.
End of menstruation.
There's often terms given to this. Some people say, it's change of life.
Absolutely. That's
Right.
the word that we like to often use because
Right.
it is a change. It's a change from our reproductive life to our mature years.
Right. Let's talk about how this happens then. I believe it's got something to do with some female hormones. Do you want to just take us through
Sure. So the ovaries, those are also commonly called the eggs.
Yeah.
They produce hormones, many hormones, but the predominant one is estrogen.
Right.
And the second one is progesterone and also testosterone.
Right.
So that's what gives you libido.
Okay,
And
so there is testosterone in females as well?
Absolutely.
Oh, great,
for
interesting.
sure.
Right. So what actually then happens? I mean...
So you can lose those hormones either surgically from an operation, through some diseases, or it's a natural process. All of us, as we age, our ovaries stop working. Ovaries are unlike testes.
Right.
Ovaries have a specific lifespan, and you have a set number of eggs, and when their time is up, their time is up.
Okay. So in terms of the changes then that happen with the changes in these hormone levels, as you say, I mean, are you saying that when you reach the age of about 40, we'll come back to the actual ages, something happens to the levels of these hormones that result in certain changes? Take us through those changes.
So as we age, our hormones start to fluctuate. Our periods may become irregular, and then your symptoms of climacteric or your change of life starts to begin. So it will fluctuate. In some women, it'll be a sudden stop. And obviously, if you have an operation that removes your ovaries, that's called a surgical menopause. And that's much more dramatic than somebody who goes through a natural menopause.
Okay. I mentioned ages later.
Sure.
Let's just come back to this notion of sometimes you hear words like premenopause, perimenopause, or the
Absolutely.
transition period. Post-menopause. It can be quite confusing to some people.
Absolutely.
Can you just make it simple for us?
So transition is the word that we like to use now.
Yeah.
It's the new terminology. But perimenopause is the same as transition.
Right.
And like I say, that can take 2 to 7, 8, 9 years.
Right.
So early menopause is somebody who stops menstruating and gets symptoms before the age of 45.
Right.
The average age of menopause, our last menstrual period, is 50.
Oh, okay.
And then you can be early in your menopause or late in your menopause.
Right. Okay. Now, if this is the natural process that
Sure.
all women go through, why is it that some women experience, symptoms and some don't?
Well, it's the same as puberty. I mean, why do some girls get period pains and others don't? We don't have the exact answer, but certainly some women have a smooth transition, a smooth menopause. They have no symptoms and they are fine.
Yeah.
And it often is family line. So you can ask your mom, how was your menopause?
Yeah.
What age did you have your last menstrual period?
Yeah.
And women follow often what their moms had.
Let me turn the question around and ask
Yes.
you, what
Me.
did you go through?
Right
Or what are
about-
you going through?
Oh, no, I'm definitely menopausal. I have symptoms,
Right.
hot flashes, sleep disturbance, night sweats.
Yeah.
And if you ask my children and husband, probably grumpy too, and moody. And it is a tough time. It's a tough time for family members and a tough time for that person.
Right, right. I mean, there's obviously psychological effects. I mean, you spoke about being moody.
Sure.
Does it ever get worse to a point where some people actually get depressed and have to consult psychiatrists, for instance?
Absolutely. So depression can manifest itself at the time of transition or at the time of menopause, when you postmenopausal. If you are high risk of menopause, of depression, often women who had a postnatal depression can have a greater depression in their menopause years.
Yeah.
And yes, and they need to seek help, and they can get help. It's there.
Are there any issues perhaps that put women at risk of suffering more severe menopausal symptoms?
Absolutely. Women who smoke,
Yeah.
women who are underweight, as well as women who are overweight.
So
poor-
underweight is a problem as well.
Absolutely.
Yeah.
And poor eating habits, less exercise.
Yeah.
I mean, it's about lifestyle, isn't it?
Yeah. And you mentioned smoking. What
Absolutely.
about stuff that alcohol?
Alcohol.
drugs,
So,
yeah?
in fact, that's one of the advice things we give to women is
Yeah.
alcohol increases hot flushes,
Yeah.
particularly wine, red wine. Increases your incidence of hot flushes. So you'll see, women, they'll have a glass of wine and then be having a flush afterwards.
Yeah. All right. Are there any health problems then associated with this period of menopause?
Sure.
Yeah.
So one of them is low libido.
Yeah.
One is a dry vagina
Right.
with pain on sexual intercourse.
Right.
Osteoporosis, in other
Okay.
words, decrease in bone mass. So that's why
thinning
of the bones. That's
okay.
why older
Right.
women fracture, break their hips.
Right.
As you get older, you get crouched over,
Right.
fracture your spine. So that puts you at risk.
Yeah.
And so you need to look after your bones.
Right.
You
Okay.
need to look after your vagina
Yeah.
and look after your sexual health.
All right. We mentioned obviously all these symptoms and asked the question earlier, how can these women be relieved of these symptoms? What treatment options are available, or should we call it treatment options?
It's definitely treatment.
Right.
So we no longer call it hormone replacement therapy. It's called hormone treatment.
Right.
You use it in symptomatic women who have problems.
Right.
So, for instance, hot flushes. So you would start with lifestyle modification, wearing cotton clothing, eating right, etc. And then hormone treatment for hot flushes.
Okay. Talk about wearing cotton, clothing. I just want to go back to something else now. The weather, does it
Yes.
have any effect on, the severity of hot flashes?
Obviously, hot flushes are worse in the summer
Right.
than they are in the winter.
But you do get them
But
in
you
winter
still
as well.
flush in the winter, absolutely.
Right.
And so, you'll be sweating like crazy and then you'll feel cold.
Right, right. Okay. So back to treatment then. So you say lifestyle changes and all of that. Let's talk about hormone treatment.
Absolutely.
Right, because you hear that some people say there's dangers to taking hormone treatment.
So it's about quality of life. There's dangers in everything that we do.
Right.
And so the first thing is every woman should have a mammogram before they start hormone treatment.
Why is that?
Because, there's a lot of talk about hormone treatment and breast cancer. We know that women who have breast cancer, we prefer them not to be on hormone treatment. So you must have a baseline mammogram and know your risks in terms of your breast.
Right.
And then use hormone treatment for symptom relief.
Okay.
And
what format does it come in? I hear there's tablets. Are there other
comes
forms?
in all formats.
Right.
So there are tablets, there are patches, there are creams, and there's even vaginal tablets, vaginal creams, and a vaginal ring that you can use for estrogen.
Right, right. What about herbal supplements and that sort of thing?
Okay. Very common, commonly used, but if you look at the evidence, the scientific evidence for their use, they have a big high placebo effect. So they initially work and then they don't. If you're talking about symptom relief for menopausal symptoms and you look at the hard evidence, hormone treatment helps.
Yeah, yeah. And for how long do they have to be on treatment for? The rest of their lives?
For as long as you have symptoms.
Yeah.
So if you have I have 80-year-old patients who are still flushing and require hormone treatment. So you use hormone treatment for as long as the symptoms persist.
Okay. And how long do the symptoms normally persist then?
So in many women, they subside within sort of a 4 to 5 year period, but it's very individual. I mean, we're all individuals, and so you need to assess it on a yearly basis.
Right. And where do they get treatment? I mean, where do they get advice in terms of what treatment to get? Yeah?
So they certainly, first of all, can start by going to our South African Menopause Society website.
Right.
But they need to speak to their practitioners, their general practitioner. It doesn't have to be a gynecologist.
Yeah.
We have a conference coming up in February where we're going to include a lay public session where all women can attend.
And all of that will be on the website?
That will all be on the website.
Okay, fascinating stuff. Dr. Trudy Smith, thank you so much for being part of our program.
My pleasure.
Right. After the break, we now discuss male menopause. And remember to pose any question on male menopause or just simply share your experience. The number to call is Johannesburg 714-6843, 6847 or 6857. Please don't go anywhere.
When we return, we're discussing andropause, which is male menopause.
SABC News delivers stories
that unify the nation
in many ways,
stories that inspire us
to see the world differently, appreciate
and celebrate our diversity.
And mostly,
they make this place a better country to live in,
despite our color,
beliefs
or culture.
I
am
Mahendra Raghunath
Tabile Ngwato,
Lulu Gabu.
Join us every day
as we provide updates on
local and international news
straight into your home.
We
are
SABC News. SABC News, we've got Africa covered.
Okay, you may have or you may not have come across terms like andropause, testosterone deficiency, androgen deficiency of the aging male, late onset hypogonadism, or simply male menopause. But is this a myth or fact that males also go through menopause? Well, Dr. Bradley Wood, a specialist urologist practicing in 4 Ways in Centre, will help us answer this question and more about male menopause. And remember again, if you have any questions, the number to call 714-6843, 6847 or 6857. Dr. Brad Wood, welcome to Health Talk.
Hello, thanks for having me. It's a pleasure being here.
Okay, I mean, look, males often, let me use the term sometimes, they refer to as going through some midlife crisis.
Absolutely. It's a very real thing, Silo. It's a very, very real phenomenon, especially if you're the one experiencing it.
Right.
You know, male menopause, midlife crisis, call it what you want. We usually don't use that term in the medical community.
Yeah.
And as you mentioned, it's been called many things before. And it pretty much comes down to the gradual decline of the male hormone, the main one being testosterone, which is the main androgen produced by the male body.
Right. Let's talk a bit about that hormone now. I mean, we just heard that, you know, in the females, I mean, clearly, even though females also have testosterone, the issue around menopause is related to changes in the levels of, you know, estrogen and progesterone. In men now, are the changes similar to that of women in terms of levels of testosterone?
You know, it's not as dramatic in the male as it is in the female. So, look, you know, most men that do go through andropause, testosterone deficiency syndrome, whatever you call it, may not pinpoint the exact month or even the exact year when the symptoms started. It really is a gradual decline of the male hormone, which starts in young males. You know, testosterone peaks at around mid-20s. And here's the bad news, from about 30 onwards, there is a gradual normal aging decline of testosterone. It's just when that decline is excessive to produce symptoms or associated conditions that it becomes a problem.
Okay. And how common is that? So basically we're saying, listen, this is no myth. This notion called male menopause or andropause does exist.
Absolutely. It's extremely common and becoming common because of our lifestyle, unfortunately, our sedentary lifestyle with lack of exercise and sometimes poor diets. Those predispose, you know, overweight men tend to have lower testosterone. So it's becoming more common and probably as high as 1 in 10 males over the age of 40 will suffer from testosterone deficiency syndrome.
Is it becoming more common, or are we starting to know more about it?
Absolutely, a bit of both. We're looking for it more often. You know, men are notoriously bad at seeking, health behaviors when they're not sick. You know, they wait until something's broken before coming to consult. But more and more the message is getting out there. General practitioners are learning about it and screening for it. You know, it's a simple diagnosis to make. So the more we know about, and now we can also offer effective treatments. So now that, you know, we're starting to look for it because we can offer something beneficial.
Okay. Now, you said that, I mean, obviously it's associated with declines in the level of, you know, testosterone to a point where they become symptomatic.
Correct.
And that aspect is becoming more common now. Symptomatic. What actually do men go through when they are said to be going through menopause?
Great. So testosterone is a marvelous hormone. Men have testosterone receptors from head to toe, and it plays a role in most organ systems in the body, and hence has very widespread effects, especially when it's low. From the central nervous system, it plays a role in mood. So depression and irritability and sleep disturbances are very prevalent in men with low testosterone. It plays a role in glucose and cholesterol metabolism. So conditions like diabetes and high cholesterol and high blood pressure tend to be more prevalent. It plays a role in body composition.
So they're more prevalent in those that have
low testosterone, correct.
Okay. Right.
Body composition is very much affected by testosterone. So low testosterone.
Well, talk about body composition. I mean, it's often associated with bodybuilding and muscle strength and that sort of thing, yeah?
Right, so those tend to be not our natural testosterones or androgens. Those are sort of anabolic steroids that men are abusing in the gyms, unfortunately.
Right.
But testosterone, our endogenous testosterone, certainly plays a role in muscle strength, lean mass, and it keeps your fat stores much lower.
Yeah.
So particularly the visceral fat around the abdomen, the waist circumference, we talk about that a lot, and it tends to have very high predictive value of whether you've got low testosterone.
I want us to come back to that abdominal, fat issue. But just going back a little bit now to some of the reasons or the causes or risk factors for that dramatic decline in testosterone levels.
Sure.
What are the factors there?
So age, as we mentioned, is certainly a risk factor. Your
Right.
testosterone levels will drop as you age. Some men faster than others. There probably is a genetic risk, which we don't fully understand at the moment, but
Right.
there certainly is. And to do with lifestyle too, overweight men will certainly have a much higher chance of having a low testosterone. So these are men with poor dietary habits or men not getting enough exercise.
Yeah.
Testosterone seems to vary with stress and working long hours and not getting enough sleep. So
Yeah.
those would be risk factors for low testosterone too.
Okay. Just remind us again about, the health effects now of low levels of testosterone. I mean, you mentioned chronic diseases like diabetes. Anything else?
That's the most worrisome, is the association of these comorbidities with low testosterone.
Right.
And nowadays there's a new syndrome, we're all talking about, the metabolic syndrome. These
Right.
are overweight men with high blood pressure
Right.
and high cholesterol and high sugars, so diabetes mellitus. And they almost all have high waist circumferences.
Yeah.
And most of those men, more than 50%, will suffer from low testosterone.
Right.
And there's pretty good evidence emerging now that men with low testosterone have higher morbidities, so they get sick more, and unfortunately have higher mortalities. They die younger.
That's quite worrying. Yeah. So what are you saying now in terms of recommendations? I mean, are you saying that all men, you tell me the age, should be screened for testosterone?
It's a clinical and a biochemical diagnosis. So if you have symptoms, be it fatigue, falling asleep at your desk in the afternoon, depression, irritability, loss of libido, and erectile dysfunction, in particular loss of your morning erection, that's a very good predictive tool. If you've got any of those symptoms, we would recommend doing an early morning blood test to look at your testosterone levels.
Right.
And we've got pretty good cutoffs throughout age of what's low and what should be treated.
Yeah.
And if you're symptomatic with a low testosterone, you'll benefit from an intervention, be it just lifestyle or testosterone replacement.
Well, talk about intervention. Let's talk about it then. So how then do you help men with symptoms with low levels, of testosterone?
Right. So generally we'd look at their profile. Are they overweight? Would they benefit from blood pressure medication, cholesterol medication? Are they diabetic?
Yeah.
Do they need to get on an exercise program? See a dietitian. Those are general measures we recommend.
Yeah.
But more specific, symptomatic guys with low testosterone need testosterone, so we replace their testosterone.
Yeah.
And there's ways and means of doing it, certain preparations. We also have gels and pellets and lotions and patches. Unfortunately, those tend not to be freely available in South Africa.
Right.
So our most common route of replacement would be long-term intramuscular injections.
Yeah. We believe that this is quite a costly injection, isn't that so?
It can be. The one we have available is testosterone undecanoate. It tends to be given at 3 monthly intervals.
Yeah.
Rough pricing, you can look at around about 1,500 Rand an injection, but keep in mind that covers you for 3 months. So it's around about 500 Rand a month. And there's an ongoing battle with insurers to recognize this condition and pay for the replacement. So.
Well, maybe, talking about it, because I guess people are starting to know more about, the effect of testosterone injections and so on. There's the other side, where people who are obese or have abdominal obesity with a bit of a pot belly go to doctors to demand this testosterone injection with the belief that, because they've seen it happen in a neighbor or so, that when they get the injection, the size of their bellies decreases. And there's a potential abuse there. And in fact, a lot of people are doing exactly that. Your comment on that?
Quite correct. And those are the men that need to be screened for low testosterone.
Yeah.
And if their presenting complaint is a pot belly and they do have low testosterone, you know, as a doctor, you've got to set up a patient-doctor relationship.
Sure.
And it may be that to gain confidence, if their testosterone is low, by all means, go ahead and supplement them.
Yeah.
There's a large Canadian study that showed overweight men with low testosterone compared to any other weight loss product. Testosterone fared the best. It caused the most weight loss.
But I guess, you know, it makes sense if you're talking about overweight men with low testosterone levels. But overweight men with normal testosterone levels wanting to decrease the size of the pot
Absolutely, and that's where the potential for abuse is, and we've got to be careful about that. That's why you need both sides. You need that biochemical diagnosis. And if their testosterone isn't low, they need to see a dietitian or get on an exercise program rather than have the testosterone. Because like anything in medicine, there is risks, although fairly low, with testosterone supplementation.
Yeah. Well, we spoke about the injections. I mean, anything else? Herbal, alternative medicines that people, you know, often people go to pharmacies, they see testosterone lookalikes or precursors or whatever the case may be.
Correct.
Your comment on that?
Lots of them available over the counter, these preparations. Just keep in mind, let me say something, that as soon as you swallow testosterone and it goes into your stomach, from there it goes into your liver. So you have to take massive amounts of testosterone orally, because the liver chews it up if you want to reach a substantial amount in the bloodstream. And those massive doses are dangerous to your liver. Hence, we don't have oral testosterone supplements that we testosterone supplementation.
Yeah. Perhaps, I mean, a related subject is youngsters in a sporting environment and in gyms and so on, people wanting to bulk up. There's a lot of these supplements or products that are advertised to youngsters to say, if you want to bulk up, here's stuff that you can take, you know, it'll boost your testosterone levels. Is there any evidence to that?
It would boost their testosterone levels and it would help them to achieve muscle mass very quickly. Those products are dangerous. Those are anabolic products. They cause liver cancers and they're associated with testicular cancers. And besides that, these are young guys with future fertility, and exogenous testosterone takes your sperm count to close to zero, if not zero. So these guys, although that often recovers, sometimes it doesn't recover fully. So they're playing Russian roulette there at a young age, all in the in the name of bodybuilding. So definitely not recommended.
Right. And obviously also running the risk of testing positive to banned substances in sport, especially for professional
100%.
athletes. Well, Dr. Brad Wood, this has been a fascinating discussion. Thank you so much for contributing to our program, Health Talk.
My pleasure, Silla. Thank you.
All right. When we return, we now look at nutrition and exercise and prevention of osteoporosis. To pose any question, the number again to call, Johannesburg, 011 714 6843 6847 or 6857. Stay with us.
When we return, we're focusing on nutrition and exercise.
Technology is all around us and is improving lives across Africa, like how young Nigerians are connecting to the internet. There are doctors finding new ways to save lives in Cameroon, and the South African public transport system that is now getting Wi-Fi. We have gadgets, apps and loads more, some of which play a big role in Africa's growth. A huge part of this African growth is technological innovation. To find out a bit more about social media and technology news from here in Africa and abroad, join me, Siphumelele Zondi, every Sunday at 7:30 p.m. on SABC News.
Take note of the following changes. Xhosa and Zulu News bulletins will now be broadcast at 10 p.m, followed by Sesotho News at 10:30 p.m. Siswati and Ndebele News will be at 11 p.m. and the Tsonga and Venda News bulletins at 11:30 p.m. Stay tuned to the SABC News channel.
Should marijuana be legalized in South Africa or not?
The legalization of dagga is a no to our country. Look at the rate of rape in our country because of people that
But you can't say dagga makes people
that
get
are under
raped
the
then.
influence of dagga.
When a young man comes to you and says, I'm having a problem with dagga, do you send him to jail?
We don't send them
Then
to
you already concede that you agree that prohibition is not the answer, Ms.
because
Mapanga.
our aim is to help them.
As is ours.
It is you helping them by giving them dagga. How are you going to control this? Just give me a chance. Because if you cannot control it now, as the CYP of South Africa, we say no to the legalization of dagga. No matter what you study, no matter what you tell me, I say no.
Watch Newsroom with me, Eben Janssen, weekdays at 9 a.m. on the SABC News channel.
You look nicely dressed, PAC colors, you are not in agreement. Why was the president not allowed to address conference?
Even when he was given an opportunity, he did not stand up and say, look, I don't recognize this conference.
Why didn't you do that, Mr. Mpete?
I was never given any opportunity to speak there.
Mr. Mpete cannot come to the studio and complain about what transpired in the conference.
Did you say, Banna, I will pay for the PAC? When time comes for you to pay back the money, you will pay me back.
Yes. He's lying here.
That money is mine and I did not get it back.
This information,
and I want it even now. He's a deputy there. They took 430,000 without me. He said he's the general secretary, he's the accounting officer. Where on earth can the general secretary be the accounting officer? Yeah? It's what he did.
We'll come back. Watch Question Time with me, Mpotse, Monday to Thursday at 5:30 p.m. on the SABC News channel.
Okay, after the magical age of 40, bones naturally weaken in both men and women. However, it is said that in women tend to lose more bone rapidly as compared to men after menopause. Now, with thinning of bones or osteoporosis comes the risk of complex fractures from simple falls. So what role can nutrition and exercise play in slowing down development of osteoporosis or even preventing osteoporosis? Now, we welcome into the studio Sandra Pretorius, who is a registered dietitian, to tell us all about nutrition, and Estelle Watson, who is a biokineticist, who will tell us all about exercise. Sandra, maybe let's start with you. Just a small chat around the importance of nutrition in postmenopausal or menopausal women, insofar as osteoporosis is concerned.
I think it's very important to make sure you consume a healthy, balanced diet every day. And then I think as far as prevention and or management of osteoporosis is to focus especially on sufficient intake of calcium,
right.
As well as certain vitamins like vitamin D, vitamin K and vitamin C.
Yeah. And what role do they actually play in the bones?
So calcium is specifically for healthy bone formation and maintenance of healthy bones.
Right.
And then vitamins D, vitamin C and vitamin K help with the intestinal absorption of the calcium.
I see.
So
right.
that
so
is
the
also
idea is to say,
important.
okay, get in these calciums and minerals to make our bones strong,
Yes.
so that the bone doesn't thin too quickly and weaken. All right. Now, clearly, many people don't know where to get vitamin K or vitamin C, and people people eat food. People don't eat vitamins and minerals and what have you. And that's why we have a lovely display here of some of the food types.
Yes.
Perhaps you're going to take us through different types of foodstuffs that are rich in those things that you've spoken about.
All right.
Yeah.
The recommended daily intake of calcium is 1,200 milligrams per day.
Yeah.
So it's therefore important then to make sure that you consume at least 3 portions of milk or dairy products.
Now, clearly, people also don't know what 1,000
and what a portion is.
Exactly the point. So when you talk about milk, so you're saying milk is rich in
calcium.
Okay.
Yes, yeah.
Right.
So a portion, if we talk about a portion of milk or dairy products, a portion of milk would be a glass or 200 to 250 milliliters of milk.
Right.
Or low fat, and usually we recommend low fat plain yogurt, and that is also, it's about 200 milliliters of yogurt.
Right.
Or 30 grams of low fat cheese. 30 grams, very easily, it's the size of a matchbox. That's a matchbox size, is 30 grams of cheese.
Right.
So 3 to 4 portions of that per day, where one portion would have more or less 300 milligrams of calcium in, and the recommendation is 1,200 milligrams
so if I hear
per day.
clearly, I mean, you're talking about dairy products.
Yes.
And in terms of cost now, which ones are, easily available and not that costly?
I think in terms of dairy products, it would probably be milk.
Right.
Or yogurt, or even Mars. In Kumasi it's also a dairy product.
Yeah.
So any one of those.
Yeah. And in terms of the cheeses now, does it matter what cheese it is?
Well, in terms of cheese, if you preferably a low-fat cheese, but again, there's a whole range of those on the market. So I think it's just to go and choose a low-fat cheese that is affordable to you. And like I say, a portion is 30 grams, which is a matchbox size portion.
Sure. All right. Take us through other bits. Now we've spoken about dairy products, and then vegetables. I see you've displayed
so it's
quite a
very
few
important for overall health. But then also, if we talk about osteoporosis, is to make sure you eat at least 5 portions of fruits and vegetables per day.
Right.
And then, like I've said, is for instance, and then also is to choose vegetables that's high in that the calcium content is high of, such as cabbage has got a higher calcium content.
No,
broccoli.
What is a portion in terms of vegetables?
A portion of vegetables is half a cup.
Half a cup.
Half a cup, or a small, medium-sized fruit, or again half a cup of fruit salad. That is a portion, or 100 grams.
When you say half a cup cooked or uncooked?
Raw.
Raw.
Yeah.
Okay.
Yeah. Or then we prefer vegetables to be steamed, or if it's a salad or a fruit salad, it's half a cup.
Okay.
Yeah.
So you are basically saying a variety of these.
Yes, a variety is
yeah?
good, and then like I say, vegetables with a higher calcium content would be broccoli, it would be cabbage. And then vitamin C is also good, as I've mentioned earlier, for the absorption of it, assists with the absorption of calcium. And vitamin C we will find in all your citrus fruits, as well as tomatoes, as well as guavas. So that is also important to consume those fruits. And then vitamin D also assists with the absorption of calcium, and that again we will find in milk. As well as in fish, as well as in liver. So it's also important then to have a sufficient intake of those foods. And to eat fish, we recommend eating fish at least 3 times a week.
I see you have some salt and some spices. I mean, talk about salt, spices.
Yep.
There's some people who tell you, oh, broccoli, I mean, it's yuck. In fact, even kids. I know we're not talking kids. But I mean, is that to improve the taste?
So what we recommend is to limit your intake, or to use salt in moderation, and to limit your intake of foods that's high in salt. Foods So salt, I've put the salt there just to show that we usually say when you prepare food, add a bit of salt for the taste to make it a nice acceptable taste. But then don't add salt once the food is on your plate.
Yeah.
And I've also put there nice herbs and garlic and ginger and some chili that you can grind. And the reason for that is to flavor food using herbs and spices, and thereby you limit your, the excess use of salt. So people should experiment with herbs and spices and taste that you like.
All right. Let's move away from food for a while and come to exercise. Estelle, do you want to just take us through practical exercise tips you can give to women going through menopause?
Absolutely. So I think it's important to understand that throughout our life, our bones are being broken down and being building up. And so this is where exercise plays an important role, is that in that building up. Right. So in order for the bone to build up, it needs a certain mechanical stress or a load put on it. So, we often see two extremes where people are maybe sedentary and they don't do any exercise because maybe they're too scared or they're trying to protect their bones, or they're, not sure what they should be doing. But actually what people don't realize is that's more detrimental to your bone health than being active. And then obviously on the other side of the scale as well, you don't want somebody who's with osteoporosis who's doing too much excessive exercise or the wrong type of exercise. Okay. So for example, that would be high impact jumping, ballistic, uncontrolled jumping exercises would be bad for them to do. And then also exercises that might put too much excess strain on the spine. So like a sit-up you might want to avoid, or extending your back too far backwards you might want to avoid.
I'm going to ask you to demonstrate some of these just now. But I mean, people often associate exercise with joining gyms. And of course, there's a cost element to it, to say, if I must go and join a gym, I need to pay X amount of money. Is there stuff people can do at home, in and around their homes or in their neighborhoods?
Without a doubt. I mean, exercise is actually free. The concept of exercise, there's nothing wrong with joining a gym, but you don't have to. And there's loads of ways that you become active without actually spending any money. Right. So we spoke about earlier, loading the bone. And so weight-bearing exercise is actually perfect for somebody with osteoporosis. Right. So for example...
Well, take us through some of these weight-bearing exercises.
So just before that, for example, walking would be the best thing. And it's free to do. So anybody can walk, and that would maybe be like 20 minutes a day, most days of the week, so at least 5 times a week.
And what about somebody who says, listen, I've never exercised in my life, and now you're advising me that, I must go take up exercise. What should your advice be in that instance?
So my advice would be to start slowly and progress slowly. So you would want to start, maybe walk around the block and see how you feel afterwards. If that feels fine and you feel energetic afterwards, because usually you do, then you maybe increase that a little bit more. And so you go around the block twice or whatever it might be. And a lot of people also complain about the time aspects. I don't have any time to exercise. So I would suggest maybe breaking it up, 10 minutes in the morning and then 10 minutes in the afternoon. And so you can accumulate your 20 minutes.
All right, let's see what sort of exercise, even inside their homes. I mean, what can they do?
Absolutely. So I'm going to just show you 3 to 5 really simple exercises that you can do in your home. Even maybe if time is an issue during the commercial break, you could do some of these exercises. So the first one, it's very simple. All you need is a chair. So it's a sit to stand exercise. So what you would do is move to the edge of your chair. So your bum is right at the edge of the chair. And you'd want to make sure that your posture is correct throughout all the exercises. So it's also important to understand.
So what does that mean, posture correct, yeah?
Yeah, so kind of knees at 90 degrees. So you want like a kind of 90-degree angle at the knee, and then you want your back to be up nice and straight. Okay. So especially for people with osteoporosis, we want to avoid that slouching posture that we like to do, which we do often, washing dishes, driving in a car, sitting in front of the computer. So we want to avoid that, sit nice and upright. And then the first exercise is just a simple sit to stand. So if you're a little bit wobbly on your feet or an older person, maybe you want to hold on to the chair when you're doing it. Okay. If you feel that you're quite stable.
How do you do that? So what should they do?
So you hold on and then do a stand and then sit down. Like so. Okay. If you want to make it a little bit more difficult, you could cross your arms over your chest and then sit up from there and then sit down.
How many times?
So you'd want to do it 10 times and do that 10 times, have a bit of a break, and then do 10 times again.
Right.
So, for example, you could do 10 times during the first commercial break of your favorite TV show, and then 10 times at the second commercial break. So that's the first one, sit to stand, just like that. The main thing is watching where your feet are. So don't put your feet too far under. Put it at 90 degrees, exactly.
Right.
That's the main one. The other one, so the reason why those are so good is because the areas that are most likely affected by osteoporosis is your hip and your spine.
Right.
So that would really help to increase the muscle bulk around the hip. And then for the spine, I'm just going to show you also a very simple exercise to do for your stomach muscles.
Right.
So you don't even hardly have to move. You don't have to do a sit-up or end up being sweaty or going red in the face. You could do it at work or
And anybody, doesn't it require any level of fitness or anything?
Absolutely
like
not, without a doubt. So you just lift your foot up slightly and put your hand on your knee like that, and then just push down as much as you can, not too much pressure, but a little bit of pressure. And as you push down, you're going to just contract your stomach muscles in. And you're going to hold that for 5 to 10 seconds, and then relax, and then you do that again. So pushing down, keeping the stomach muscles nice and tight, and keeping your back up straight while you do it. So that's a very easy stomach muscle exercise to do. And then just 2 more exercises. So the one is balance. The other thing with osteoporosis is that it's important to make sure that we prevent falls. So if you have low bone density and you fall, it can have serious consequences. So preventing falls, very simple exercise. If you are a little bit wobbly on your feet, then you would hold on to a supporting structure and just stand on one leg. If you feel confident doing that, then you can let go of the structure or even close your eyes. And what this exercise does is that it helps the brain communicate with the muscles to know where you are. So, for example, if you're walking on an uneven surface, the brain has a better communication pathway with your muscles to know where they are.
So you lift the leg and you keep it there for how long?
So just for about 30 seconds. So half a minute. Count to 30 slowly. That would be perfect. I mean, it also depends how stable you're feeling. So if you're not feeling too stable, then hold on, get your balance, and then try and let go as much as you can. If you're getting really good at it, you can do it while you're brushing your teeth, washing dishes, whatever.
And obviously you change.
Change over legs, so do 30 seconds on each.
All right. And of course, walking around as well.
Exactly. Walking is also important.
This has been so fascinating. Ladies, Sandra Pretorius, Estelle Watson, thank you so much for contributing to our show. All right, it's on that note, unfortunately, that we come to the end of our show. If you'd like more information on menopause, you can contact the South African Menopause Society on telephone number 031 572 3260 or simply visit their website at www.manopause.So.za. Okay. So join us again next week on SABC News. Watch our repeat shows at 2 p.m. and 10 p.m. tonight. Remember that you can also watch Health Talk on the YouTube channel. So from myself, Dr. Salome Taung, and the rest of the team, goodbye from me and thank you for watching.